sort of based the focus of the room on that. We can go ahead. Go ahead. Yes, I was going to say we can just go ahead and do a quick round of introductions. So just
I'm happy to go first. I'm Tessa Christensen. I am with Best Care Treatment Services. I work in um, development at Best Care, and this is my second year on the committee.
I'll go. Um, I'm Andrea Brown. I am a new member of the Healthcare Workforce Committee, and I am also the Traditional Health Worker Liaison for Umpqua Health Alliance TCO in Douglas County. And I sit on the Traditional Health Worker Commission and the Traditional Health Worker Systems Integration Subcommittee.
My name is Regina Castellan. I'm in Southern Oregon, Jackson, Josephine County. I'm from All Care Health. This is my first year in the committee. My title at All Care Health is Director of Equity and Tribal Partnerships. And I'll throw it to Grace, who's next to me.
Hi, everyone. My name is Grace Gunther. I'm from the UW Center for Health Workforce Studies. And pleasure to be here. I'll be taking notes today.
I'll go next. Hi, everyone. I'm Molly Reynolds. I'm a committee member. I'm a program manager with Rise Partnership. We specialize in home care workers, personal support workers, personal care attendants, providing them with training and job opportunities to move into CNA programming, LPN programming, and beyond. Thank you.
I can go next. Hi, everybody. Sorry, my camera's off. I have a little cold today, but hopefully next time I can put my camera on. But I'm Sophia. I am a new committee member, and I currently work at EOCCO, and that's our most Eastern Oregon coordinated care organization. So primarily work in rural health, specific to quality metrics.
great. John, do you want to go next?
Sure, I wasn't sure if all the committee members had gone, but hi everybody, John McElfresh, and I am the Oral Health Workforce Coordinator in the Healthcare Workforce Initiative team with DeepT, and primarily what I do is coordinate grants that are centered around expanding access to oral health care in specifically targeted underserved areas. So good to be here today. Is everybody else gone? Feel like we have, yeah, okay.
Neelam, would you like to go next?
Yeah. Hi, everyone. Neelam Gupta, she, her pronouns. I'm the Director of Clinical Supports Integration and Workforce here at OHA. Great to be here with you all.
Great. And then Nicole, I think you introduced yourself in the chat. And it sounds like you are also out a little bit with a cold. So I think has everyone had a chance to introduce themselves? I think so. Great. So since we have two topics to get through today, I think what we'll go ahead and do is start with the social determinants of work part. And I know that it seems like from who we have on the call today, more people would have subject matter expertise about that topic. But I also want to make sure that we cover oral health. Just by either saying something or raising your hand, who would like to talk about, or who feels comfortable talking about oral health today and had a perspective on that? I know, John, that you do, and Regina. Okay, great. All right. Great. Well, okay, great. And Sophia as well. We'll try our best to cover both topics. And just so that I mention it, we are recording the breakout rooms today, and so that recording has started. So we can go ahead and start with social determinants of work. And I posted the last needs assessment there in the chat. And the social determinants of work section starts on about page 21 um, of that PDF, just as a refresher of what was in there in the last report. And so I think we can go ahead and start with the questions that Regina posted into the chat. These 4 questions are all based on things from the last report. So basically, what worked well in the last report and what should we keep? Which areas would you like to see expanded or added into the social determinants of work group? Is there anything that really you feel didn't add value and that you would want eliminated or removed? And then just in general, what is important for us to know moving forward? And I think we don't need to take these one at a time. We can just have a general conversation about the social determinants of work and what worked well and what didn't work as well in the last report. And just as a overview, we defined social determinants of work. There's a good framework with some visuals on page 22. And we describe them as an interconnected web of challenges that workers must navigate daily to thrive and arrive at their workplaces. And they include things such as childcare, broadband access, healthcare for themselves, transportation, housing, job flexibility, and transportation, and things like that. And so the last report talked a little bit about each of these things. And then they also made the link to how in Oregon, female providers are really overrepresented in most professions. Um, and then different groups that are both underrepresented and overrepresented going through each of the positions and how that might impact things with these social determinants of health. The last report talked a lot about housing and the housing incentive program that was brought out by OHA, but also, how that's limited in scope. And so it was a pretty short section on social determinants of health. Social determinants of work. And so I think there's definitely room for improvement. But we would love to hear from you all about these questions. So I'll open it up to anyone who wants to get off mute and provide feedback.
I can start, Deepti.
Wonderful.
One of the things I'm just noticing on third glance of this section in the report is that a lot of the incentivized supports like childcare and housing support are offered to folks who are already in the fields, as opposed to wraparound supports for folks who are trying to enter the fields. So I'm just thinking, of course, from my own perspective and what I do and what my organization does as far as trying to provide wraparound supports for folks who are entering training programs to begin their journey in the healthcare fields. So I'm just suggesting that maybe there is some kind of emphasis or some kind of note that in order to reduce the barriers to entry into these fields, there could be an exploration of providing supports at the very beginning of folks' journey in healthcare, if that makes sense, instead of when they're already working as nurses, but to kind of back up a little bit and see what kind of supports can be provided or what kind of incentives can be explored for folks who are like I said, at the very beginning of their journey in healthcare.
That is great feedback. And you don't have to, I don't want to put you on the spot, but if you know of programs like that exist that we could highlight in the needs assessment, we would love to hear about those.
Okay. Well, at Rise, we're developing those programs, but they're not, they're in progress. So, but if the state could provide more opportunities for programs like Rise and programs that are similar across the state to then offer those kinds of wraparound supports for folks as incentives for starting training, continuing with training, that kind of thing. just a thought.
That's great. Thank you. Did others have any feedback about this section?
Just to add of what Molly mentioned, and maybe you implied this, Molly, in regards to training, is shadowing and the power of shadowing. Healthcare can be so complicated. It is, I was going to say it can be, it is complicated. And sometimes I think people do not know something exists within healthcare of skills just because they just don't know that that skill can be developed, can be learned, and can be, you could be of service. Years can go by and you just don't know. And it's almost like a gatekeeping, but it's not intentional at all. It's just that we're all in our own little worlds and like doing things. And so I feel like there needs to be breakthrough on that. And I don't know how, but you brought up that to me, Molly, that there's that shadowing piece that you don't know what you don't know about certain skills that you can develop and be of service if you know.
Yeah, Regina, just to kind of speak to what you're talking about here. At Rise, we're really developing a lot of new programs, and one of the programs we're developing includes some education around healthcare careers. So we're kind of developing that curriculum, and that's something that we're going to be rolling out specifically to to people who are already care providers, like home care workers, that kind of beginning of the workforce lattice folks, right? So we've Rise is affiliated with we grew out of SEIU 503. So the folks who we serve with education and training and career pathways are home care workers, personal support workers who are employed by the state of Oregon and who are union members, SEIU 503. And we've done lots of surveys with those folks, and they've indicated a very strong interest in learning more about the healthcare fields that are possible for them, learning more about, progressing in healthcare and what that looks like, and how we can address these potential barriers to their progress, and to remove barriers. So, just to speak to what you were saying. I know my organization is just beginning to kind of offer those, like, hey, this is a menu of things that the menu of options, a lattice of potential opportunities, and this is what each one of these roles entails, and this is what it's like, and here's what the education you need, and let's help you get in the direction you're trying to go in. So we're just starting some of that work, but it definitely needs to happen on a grander scale across the whole state, I'd say. So. Thanks for supporting that.
Great, thank you. Are there any other pieces of feedback about the last assessment? I think we've already sort of moved on to the next piece, which is in terms of looking ahead to the next needs assessment. What are the most pressing workforce issues for this profession? We've already touched a little bit about that, but would love to hear more feedback about that. We would also love to hear what data sources exist for this needs assessment that we can pull from. And then similarly, are there reports or materials that about this topic that we could review or incorporate into this report? So would love to hear more from you folks about those things. And I guess specific to social determinants of work, are there pieces of that framework that you feel are really more important or more pressing? In your expertise, do you hear about, housing and childcare, for example, more than transportation or other things? So would love to hear your perspective on that.
I have a couple of things. So I don't see in this small section in this report any mention of traditional health workers, which is interesting to me. Registered nurses, medical assistants, and some other professions are mentioned in here, but not traditional health workers. And I think that's really um, unfortunate because traditional health workers are going to be significantly impacted by a lot of these things around childcare and access to healthcare. Traditional health workers, by nature of their role, are from the communities they serve. They have intimate understanding of social determinants of health and are also generally impacted by those things in their roles as well. So, they generally, if you're lucky, make somewhere between 17 and maybe $22 an hour. And are often trying to help people who are really struggling while they are struggling themselves. And there's a really high rate of burnout as a result. Um, so I think that and the additional challenges, right? Like we can assume with a lot of other worker types that, you're not going to have a lot of registered nurses likely that have a significant criminal history. But that's not true with the traditional healthcare workforce, which also makes things like housing and some of these other issues extra challenging for them. So uh, I think that this, touches the the surface for a lot of the worker types, but it doesn't even barely scratch the surface for traditional health workers.
Thank you, Andrea. I did so the last needs assessment, it does have a small section on this workforce. It's sort of broken out. There were 10 different workforces that were covered in the report. And so one of the 10 was traditional health workers. But it's not, I see what you're saying, and it's not currently tied to the social determinants of work. Section, but it starts on page about, I think, 77 of the report. And since that's one of your areas of expertise, we would love for you to take a look at this section and provide feedback on this section, or of course any sections. But this is one of the areas where we do have good reports and data about, because it's a program that's managed by the Oregon Health Authority and we have good connections with them. But I think what you were saying is that it doesn't currently tie to some of those social determinants of work that we were talking about. It's a standalone, very much a standalone section.
I would just kind of piggyback off of that in that that's what we experience at our work as well. And I don't think it is addressed enough because it's really hard to provide that additional support. We have trouble with our peers and even some of our CADCs that really have a challenge supporting themselves with childcare and transportation. And the other thing I think about the importance of it, to me anyways, is really being able to navigate a way to elevate those challenges, in order to have them be successful and grow in the healthcare workforce, and also have an incentive to grow beyond, where they are into, higher positions, or just to become self-sustaining.
I would echo that too. And I'm specifically thinking about THW birth doulas because I work with them a lot in my own work. And I know that THW birth doulas are the only THWs that are able to bill Medicaid directly without being under a provider, which is really great. But it also is a huge barrier because they have to get an NPI and it can be very confusing, and also handling, insuring themselves. It could be very costly. And I think that's a huge reason why a lot of, THW birth doulas might get into the profession and say, oh, actually, this is a little bit harder than I thought because of all of the administrative burden. And then they'll stop. So I would love to see on this report just a little bit more information about birth doulas.
That is great feedback. Oh, okay. So we are gonna move along to the oral health part. And for your reference, the current oral health section starts on page about 72 of the PDF. And just quickly, it talks about the workforce in Oregon, the different types of providers that make up that workforce. Um, it talks about some of the shortages that exist in areas of the state by FTE and the population. There's a few good maps in there. There's also a section on the race and ethnicity of oral health providers in Oregon and the areas that are underrepresented. There's also a small section on specific challenges that exist for the Medicaid population and OHP as it relates to oral health. And then there's also a section about the future of the workforce and some recommendations around that. And so in the few minutes that we have left, I would love to take you through the same set of questions. So what worked well? What would you like to see expanded? Is there anything that you would see eliminated? And what would you like us to know moving forward about the last report and how it relates to oral health? John, do you want to get us started? I saw you come
Yeah,
up.
sure. I was just giving committee members a chance to open up before I monopolize the conversation. Well, there are a few glaring omissions, or I guess things that I feel like were inadequate in the last report. And one thing I think that specifically needs to be highlighted within the oral health section is the maldistribution of providers throughout the state of Oregon. Um, as many people on this call probably know, Oregon in a lot of areas has an adequate number of providers, but not so much in a lot of rural areas. And so I know there's tidbits within the oral health section that illuminate that or highlight that, but I think there needs to be a greater emphasis on that particular aspect. And in that same vein, a lot of the data seems to be specifically around population to provider ratio seems to be based on providers for every 10,000 residents. I'm not sure where that number originated from. Federal metrics usually use one provider for every 5,000 for determining things like dental health professional shortage areas and network adequacy. So one for every 10,000 seems a little arbitrary. Uh, my tidbits for now. I'll let everybody else jump in.
I can jump in a little bit. Yeah, so in my work in with EOCCO, I'm specifically thinking about Harney County, which is the county that's kind of central east. It's very rural and frontier. And last year they had one dentist in the entire county, was in Burns, and that dentist decided to close their practice in Burns and move to Bend, which means that that entire county did not have a dentist, which is something that we're starting to see more and more. And I just think that like retaining dentists in Eastern Oregon or just in rural Oregon in general is a huge, huge problem and a barrier. Just, dentists and just providers in general, they don't want to live out there. And then maybe the people who do move out there for the rural health loan forgiveness will just get their loan forgiveness and then move back to maybe like Portland or another urban city. So, yeah, I think this is a very pressing issue in our most rural counties. And I would love to see some work around specifically like retaining dentists and maybe some sort of incentive to stay in those towns.
That's great feedback. Thank you. In the last couple of minutes that we have left, I also wanted to we have 1 minute. Are there any issues you feel are very pressing for this workforce? I think we've already covered some of them in terms of being able to retain dentists as the certain incentives run out. Are there any data sources that you feel we could use in the and you can also follow up with us later. I know we only have a minute left, but we would love to hear about data sources and reports and materials that we could incorporate. And Sophia, I'll probably cut us off, but can you say a little bit more about the quality metric data?
Yeah, okay, I have 20 seconds. So quality metric data is basically data that the CCOs have to report on. And there are two oral health measures right now, preventative dental measures that track specifically preventative health, oral health for pediatric children.